Hi friends, so with the next exam upcoming, it is very important that we also change our pattern of study. So in this video, you can look at the wash basin area of an operation theatre where they are depicting two important charts, which are your 6 steps of your hand washing and your 5 moments of hand hygiene. So let's take a look at them. Now, hand washing and surgical infection. Now, hand washing has been very instrumental in reducing the surgical rate of infections. Now, regarding your 6 steps of hand washing, first question that you need to remember that there are 6 steps of hand washing. So, the first step of hand washing is palm to palm and between fingers, right? The second is your back of hands. The third is your knuckles. Right. Fourth is thumb downwards. Fifth is your tip of fingers, and sixth is your wrist to elbow. So these are your 6 steps of hand washing. Now the questions that can be framed: how many steps of hand washing? It might look a silly question to you, but then trust me, I've got a lot of messages in my inbox where the students have confused the moments of hand hygiene with your steps of hand washing. So there are 6 steps. The next question that can be framed from here is your 6 steps order. So this particular order needs to be followed. That is palm to palm, then back of hands, knuckles, thumb downwards, tip of fingers, and the wrist to elbow. Right. Now the next important chart which I had showed you in the video at the wash basin area of an operation theatre was the 5 moments of hand hygiene. Now what are these 5 moments of hand hygiene? Now the first is your before touching a patient. The second is before clean and aseptic procedure. Third would be your after body fluid exposure. Fourth is after touching the patient. Fifth is after touching patient surroundings. Right. So these are your 5 moments of hand hygiene. Now, what was the purpose of giving this video to you? Dear students, when you would be doing your clinics, this would be some of the basic things that you would be coming across, like hand washing. No matter what, you would be having a compulsory surgical posting, right? So for that you would be needing to scrub to OTs, and this hand washing is a mandatory thing. So the next questions can actually be framed from your basic clinical practice that you would be doing or are doing. So make sure that you do not miss on this important concept. And now when you're doing this sort of practice questions, like in your clinical based scenarios, for example hand washing and all, now you can actually draw collaterals and even revise other sort of question. So I've just taken a 2 sample questions over here, like what is the most common source of infection? The answer is endogenous. And then what is the decisive period? Right, the decisive period, which is for your bacteria to grow to reach a certain level to form an infection in an organism, that is usually your 4 hours. Right. So now we would be discussing at GAMEPG Clinics app more such videos where we'll be trying to integrate your clinical scenarios into your MCQ frame so that it becomes very easy with the next exam upcoming for you guys. Thank you.